To initiate our process of looking at the ankle, we always do it in a systematic approach. In the systematic approach, we'll improve our efficiency and make sure that we don't miss anything or any of the major structures. When we evaluate the ankle, we start on the medial aspect, looking for the tibialis anterior, moving laterally to the extensor hallucis, and further lateral till we see the area of the extensor digitorum. In our process, we'll place the transducer in a short axis position across the distal aspect of the tibia, and we'll evaluate the tibialis anterior, or also known as the anterior tibialis. Placing some gel across the anterior part of the ankle, we'll go ahead and place the transducer right at the aspect of the distal end of the tibia, and we'll look for a large structure, oval, sitting very close to the surface of the transducer, which is the short axis of the tibialis anterior. Now we can turn the transducer 90 degrees clockwise or an orthogonal plane, and then we'll see the same structure in its long axis. Important to remember is the bone landmarks that will help us determine where we are. The tibialis anterior, the fibers are going to run in a linear fashion when we're in long axis, and just deep to the tibialis anterior, we're going to see the distal tibia. Sliding the transducer towards the toes, the distal end of the tibia will be falling away, and we'll see the typical shape of the dome of the talus with the articular cartilage sitting on top or adjacent to, in conjunction with, the dome of the talus. In this point of view, if you look at this wedge-shaped structure sitting between the tibia and the talus, is the fat pad, and an area that is a common area for collection of fluid and for impingement from spurring coming off the distal tibia. So fluid in this situation would be accumulating in this deep area of the joint space and would displace the fat pad proximally or superior towards the transducer itself. And again, sitting just superior to that, you'll see the fibers of the tibialis anterior. Once again, rotating my transducer back into the short axis plane, I have the anterior tibialis or tibialis anterior in its short axis. Moving the transducer to the lateral aspect, you'll see the myotendinous portion of the extensor hallucis muscle and tendon. Superficial to that, you'll see some fibers as I move my transducer back and forth. You'll see some very thin fibers that roll across the top of the tibialis anterior and the extensor hallucis, which is the extensor retinaculum. And a very good way to test the structure of what tendon we're looking at is if you move the large toe, you can actually see the muscle of the extensor hallucis flexing back and forth, what guarantees us which tendon muscle structure we're looking at. Continuing into a long axis view, once again we're going to rotate the transducer into its long axis. Now it can be confusing of which tendon we're looking at. Once again, I'll offer the dynamic maneuver that helps us locate which tendon that we're evaluating. By moving the toe back and forth, the large toe, we can actually see the tendon and the muscle of the extensor hallucis longus slide back and forth, assuring that that is the tendon of evaluation rather than the tibialis anterior. Turning the transducer back into the short axis again, we're going to look slightly deep to the area of the tibialis of the extensor hallucis, and we're going to see the dorsalis pedis artery. Just adjacent to the dorsalis pedis artery, we're going to see the area of the deep peroneal nerve. The nerve will have its typical structure of a circular structure with hypoechoic areas in it, and if we move the transducer inferiorly, we'll see the deep peroneal nerve is going to cross over the top of the dorsalis pedis and move on to the medial aspect. By going back and forth, we'll see the nerve cross over, and then it comes back to its more lateral position. Continuing moving in the lateral projection or lateral position, we're going to go over the side of the lateral aspect of the tibia until we see the tendon structure in short axis of the digitorum. As we move the individual toes, we can see the movement in short axis of the extensor digitorum. Once again, looking just superficial to that structure, you're going to see the fibers of the extensor retinaculum. Going just a little bit deep, we're going to see the talus again in the articular cartilage sitting on top of the talus. Rotating the transducer once again into a long axis, we want to assure that we're looking at the proper tendon structure. So by moving the toes back and forth, we can actually see the digitorum sliding back and forth, and that way we can be assured of what tendon structure we're looking at. One other aspect, and this is for the more advanced evaluation, is when you look at the deep peroneal nerve in its short axis and sitting onto the tibia and the dorsalis pedis artery pulsing just to the right of that. As I move the transducer towards the toes, the deep peroneal nerve will cross over the top, and as it goes over the top and I continue my downward motion, we can see that the deep peroneal nerve is going to divide into a medial and a lateral aspect, with the medial section supplying the first web space and the lateral aspect supplying the area of the dorsum of the foot. The last aspect that we're going to look at on the anterior ankle is as we move the transducer over more towards the fibula, we're going to see once again the talus and the tibia. And deep to that is going to be a recess known commonly as the lateral gutter. This is a common area for soft tissue impingement, and how we would test for soft tissue impingement, we would actually dorsiflex the foot and look for any kind of loose bodies or impingement of the two bone structures in the joint space as they move across each other.